Military Occupational Specialty, Respiratory Specialist. Skilled in reliably administering respiratory therapy to ill, critically ill, and trauma patients on a regular, emergency, and critical care basis. Specialized duties include making adjustments to ventilatory life support systems based on interpretation of blood gas data, as well as providing advanced cardiac life support to patients during an emergency. In the Army, this career is crucial to the entire medical field. You will attend the Inter-Service Respiratory Therapy School that produces graduates who perform at the highest level of respiratory care. You will take the National Respiratory Therapy Certification exam and may be eligible to become a registered respiratory therapist with the National Board of Respiratory Care. Graduates from this highly advanced program are eligible to earn an associate's degree in applied sciences with an emphasis in respiratory therapy. Respiratory specialists are trained to examine, treat, and care for patients of all ages with a wide variety of emergencies, as well as chronic respiratory disorders. You will be responsible for the care of all members of the armed forces, retirees, their families, and may also treat civilians in emergency situations. Upon graduation, you may be assigned to a regional medical center or to a combat support hospital, where your duties may include supporting your unit in humanitarian, peacekeeping, and combat operations. Like other members of the healthcare team, you will work a variety of shifts, which may include weekends. Your duties include treating and assisting with the management of respiratory care to patients that require inpatient or outpatient therapy, serving a vital role in emergency situations. You will provide mechanical ventilation to patients in medical, surgical, pediatric, or neonatal intensive care units. You will also manage patient airways by delivering medical gas therapy, administering cardiopulmonary medication, and performing chest physiotherapy to patients throughout the hospital. As a respiratory specialist, your duties include transporting patients within the hospital. And you may have the opportunity to become a member of the critical care air transport teams, moving patients anywhere from one regional medical center to another or around the world. As a respiratory specialist, your duties may include working in a pulmonary function laboratory, performing blood gas analyses, assisting with fiber optic bronchoscopies, administering cardiopulmonary stress tests, and measuring lung volumes using state-of-the-art equipment. The training and experience you gain while serving as a respiratory specialist will help you transition from the military to the civilian employment sector. As a member of the Army Healthcare Team, respiratory specialists are dedicated to conserve the fighting strength. Army Medicine, bringing value and inspiring trust.